To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is today's COVID-19 briefing for British Columbia. We are honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. As you know, tomorrow we will be joining the Premier as he makes announcements tomorrow at 3 o'clock at our regular time. There will be a written briefing in advance of that, which gives the daily case numbers and other relevant information about COVID-19 in BC. That will be a written statement before 3 o'clock tomorrow. And with that, I'm happy to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, May the 5th, we have had only 8 new cases test positive today, bringing our total number of cases in British Columbia to 2,232. That includes 849 people in Vancouver Coastal Health, 1,031 in Fraser Health region, 124 people on Vancouver Island region, 177 people in Interior Health region, and 51 people in Northern Health. We continue to have active outbreaks in long-term care and in assisted living and acute care, and we have 22 active outbreaks right now, including 1 new long-term care facility outbreak, Evergreen House in Vancouver Coastal Health, and 2 new outbreaks in acute care units, one at Ridge Meadows Hospital and the other at the Richmond Hospital, both again in Vancouver Coastal Health. That brings our total number of people who are positive for COVID-19 in our healthcare system to 442, including 271 residents and 171 staff. On a positive note, however, we have 17 outbreaks that have been declared over in long-term care and assisted living, including one of our very first one, the Lynn Valley Care Centre outbreak is now officially over, and all of the people who were affected in that facility have recovered now, which is really great news. In addition, the MSA Manor outbreak and the outbreak at Hawthorne Park, Orchard Manor in Interior Health have been declared over. In terms of our community outbreaks, there continues to be 7 cases at the Fraser Valley Specialty Poultry. I understand that even though the investigation is ongoing, the inspection of the facility that was closed for a number of days, and the facility has put in the appropriate measures and has now reopened. Superior Poultry, we continue to have cases there with an addition of 1 case up to 55 and 35 cases at United Poultry. We're now at 134 cases. We continue to be at 134 at the Mission Federal Correctional Facility, including 121 inmates and 13 staff. And the outbreak investigations continue in all of those areas. We have now 78 people with COVID-19 who are in hospital in British Columbia, and of those, 21 are in critical care or ICU. Sadly, we have had an additional 4 people who have died from COVID-19 in the last day. 3 of those people in in the Fraser Health region, and 1 in Vancouver Coastal Health. And as always, our hearts and our thoughts go to the families and the caregivers and the communities of these people. We have 1,472 people who now have fully recovered from COVID-19 in British Columbia. Yesterday, we shared information on where we have been and where we may go in the coming weeks with COVID-19, with our pandemic here in British Columbia. And what I need to remind everybody is that we are not yet through this. We are, as I mentioned yesterday, very likely at the end of our beginning, but there's a long way to go for all of us, both here in BC, in Canada, and around the world right now. The orders and restrictions that we have put in place are still in place. So please don't start planning your play dates and expanding your bubble too soon. We need to hold the line right now. We still have outbreaks that are happening in our communities and in our long-term care and acute care facilities. We have put the brakes on it, for sure, and that is a testament to the work that everybody has done across this province. But we have not yet stopped this train. And as the modelling has shown, moving too quickly can undo all of the work that we have done. We must continue to hold the line on COVID-19, even as we gradually ease some restrictions in the weeks ahead. Finding that fine balance that is unique for us here in BC for the experience that we are going through with our pandemic. It is a global effort, but it's also an effort that we need to do here together. Our new normal, the principles that I talked about yesterday, will apply to everybody. And as I said, there are some things that will not change in the coming weeks and months. These are our playbook for the weeks and months ahead. We need to keep them top of mind and use them as the guideposts for our actions in the coming weeks. Equally important is making sure that others, so the different sectors that are opening up in our community, in our business, in our economy, we need to have these measures in place to give us all the confidence that when we go into a store, if we go to the park, that we're with our family, that everybody else is taking the same measures as well, and that we're taking care of each other by doing these things. None of us know the circumstances of the people that are around us, so we need to continue to be kind to them and not make assumptions, to be tolerant with everybody, and making sure that we support us all. We know that this has been a very trying time for everybody, and that sometimes that can lead to anger and frustration. We need to remain calm and remind ourselves that it's kindness that will help us get through this. I'm going to talk very quickly about our principles again, and you will hear us talking more about these in the coming days. We need to stay informed and stay prepared, and part of my role and our role is to make sure that we give you all the information you need to do that. You need to continue to clean your hands and cover your mouth when you cough and avoid touching your face. With no exceptions, we need to be very vigilant about staying home and staying away from others if we have any sort of illness. And this is going to be incredibly important, not only for the coming weeks and months, but as we go into the respiratory season next fall. We need to maintain our physical distancing when we're outside our home, when we're in the community. That's a way that helps us protect each other. Few faces and big spaces is what we need to think about. No handshaking or hugging for right now, for the people that are outside your household or your pandemic bubble. Keep your number of contacts low, in particular if you have people in your household, in your family, who are more vulnerable to having more severe illness from this disease. And outside is always preferred over inside. We need to make the necessary contact that we have when we're close to each other safer by putting in place some of those administrative or engineering controls that can help us have safe close contact. That includes those plexiglass barriers or reducing the numbers of people in a shop, for instance. We need to continue with our increased cleaning of those high-touch areas, both at home and at work and in the community when we're out and about. And we need to consider the use of non-medical masks for those short periods of time when we may not be able to keep our physical distancing. In addition, we need to be very cognizant about reducing our non-essential travel and what that will look like in the coming weeks and months. More than ever, as we continue to face COVID-19 and our pandemic here in BC, what we do today as individuals makes a difference to us all. And we've seen that in the past few weeks, how important and how effective that is. Our shared health and well-being relies on all of us to work together on this and to support each other. And today being Mental Health Week, it is ever more important that we maintain our social connections and our support for each other. Side by side, we're far stronger together, even though we may be apart. So let's continue to be strong, but also to be kind and to be calm and to stay safe.
Thank you very much, Dr. Henry, and I want to start, first of all, by extending my condolences, our condolences to the families of the 4 individuals who have passed away from COVID-19 in the last 24 hours. We grieve for the families who have lost a member. We know that those individuals are grandparents and fathers and mothers and brothers and sisters and friends, and we understand that the grieving that those families and friends must feel is, of course, theirs, but they're also members of our community, and we grieve for them as well. We want to pass on our condolences. Dr. Henry has talked about the 8 new cases of COVID-19 today. We also have 78 cases that are in hospital. Just to give you a sense of where they are, 39 of those are in Fraser Health, 4 in Interior Health, 3 on Vancouver Island, 3 in Northern Health, and 29 in Vancouver Coastal Health. There are 3,959 empty hospital beds throughout our system. That means that we're running at about 64.5% of capacity. In critical care, we're operating at 46.6% of capacity, similar to the numbers we gave you yesterday during the modeling presentation. I want to make a couple of points about that and then talk a little bit about PPE and where we stand and where we are with respect to PPE in BC. All of you know the sacrifice many people have made to ensure, especially that our acute care hospitals are safe. Running at 60% capacity means that there are a lot of things that we typically do in critical care that we aren't doing. And of course, yesterday, for example, we had about 4,650 people visit emergency rooms across BC, which is up from where we were at the beginning of April, but down from where we typically are. But part of the reason we did that was to ensure that people were safe in our acute care hospitals, that our healthcare workers were safe, that patients were safe, that we were ready for COVID-19. One of course, the important parts of keeping prepared for COVID-19 and keeping healthcare workers safe is around the acquiring and ensuring that people have adequate PPE, that people have adequate masks, adequate gowns, adequate eye protection, adequate glove supply. And so I just want to give you an update, as I have on previous Tuesdays, as to where we are. Like a lot of jurisdictions, we haven't been in a position to stockpile to the point of surplus PPE, but we're making sure that healthcare workers have the PPE they need to keep themselves and their patients safe. In the Tuesdays leading up to this, if you'll recall, we announced, they've announced the following PPE has arrived in BC. That's 3,750,000 N95 respirators, close to 3 million surgical masks, close to 1 million pieces of eye protection, which includes goggles and face shields, almost 6 million pairs of gloves, and several hundred thousands of gowns. Today, I can tell you we received just yesterday an additional 503,000 gowns, 100,000 surgical masks, and 29,000 more pairs of goggles. These are big numbers, but remember, we need to test PPE and make sure it's safe and that it meets and exceeds our standards and Canadian standards for PPE before it gets into the system. We're doing that. We're doing the testing. We have a very robust protocol, very robust testing for PPE. While we test new and alternative PPE that we've received, I'm happy to say we've managed to maintain a steady supply of our traditional familiar products that healthcare workers can continue to use. I believe the people involved in procuring PPE and working on this question have done an excellent job in a very challenging and competitive international marketplace to protect healthcare workers, and that work will continue. I want to emphasize with respect to acute care hospitals, the need for people who are not doing well, who may need to go into an emergency room, to stay in touch with the healthcare system. This includes those whose surgeries have been delayed. If your circumstances change, if your health changes, please be in touch with us. Please be prepared to use health services which are waiting for you now. This is critically important in ensuring that people stay well or stay as well as possible and maintain their health during this difficult period. To be clear, if there's a reason to call 911, a reason to go into an emergency room, please do so. It is important for you and important for everyone. Tomorrow, the Premier will be speaking about measures we're going to take. Sometimes it's called, we're talking about it being our strategy, our view going forward. Some other jurisdictions I know in the past week have put forward plans to open up their economies. And just note, as we prepare for tomorrow, that many of the sectors of society that have been opened up in other jurisdictions, from garden shops to construction, to resource sectors, all of these have never been closed in British Columbia. So this means that we've managed by following the science here, by ensuring that those who continue to work do so safely, to model the kind of behavior we're going to continue to need to model in the days and months to come as we prepare for this summer, which we hope and we believe will be a summer of renewal. And I want to just underscore in that respect the role the health system plays in that. Physical distancing, as you know, saves lives. It's the most effective measure that we can take to stop the spread and flatten the curve. It's the most important measure we can take to ensure our hospitals don't experience a COVID-19 surge. And it's the most effective measure we can take to ensure our healthcare system remains strong for ourselves, for the ones we love, and for the ones we don't know. By staying 100% committed to what Dr. Henry asks, for 100% committed to what we ask of each other, by staying 100% all in, we will make this summer our BC summer of renewal for those awaiting surgeries, for ourselves, and for our economy. Thank you very much, and we're happy to take your questions.
You want to do French?
Thank you. So as a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question today is from Camille Baines, Canadian Press.
Hi, Dr. Henry. I'd like to know how much of its testing BC does plan to utilize in the next few weeks as we relax restrictions, and how much of an increase in testing would that be in terms of numbers compared to now?
Sorry, the first part of it was what our plan is for testing in the coming weeks?
Yeah, like are we going to, how much of the capacity of the total amount of testing that we could do are we going to do in the next few weeks?
I think the challenge with testing is we have the capacity that we believe we need right now, and we've opened it up, as you're aware, for anybody with symptoms in our community to be able to be tested for COVID-19 if it's appropriate. And that will continue. We are going to ramp up as we head into the fall, when we know that we'll have more respiratory illness, and that we'll be wanting to test for both influenza and COVID at the same time. And they're very similar use of the swabs and the machines, for example. So we are intending to ramp up, but right now we have the capacity that we believe we need to make sure that we are detecting any cases and any clusters in our community, and we have sufficient testing so that we can rapidly investigate clusters that arise, as we've seen at the 3 poultry plants, as well as at the Mission facility, and other outbreaks that we've seen, including ones in long-term care. So there's no specific numbers of tests that have to be done each day. What we need to do is make sure that we're testing the right people, and that we have the availability to test everybody that we need to, who it's appropriate to test.
Next question is from Penny Daflos, CTV.
Thank you very much for taking my question. Alberta has now rolled out a contact tracing app, while Ford in Ontario wants a national app. Now that BC is going to be relaxing restrictions, contact tracing will be even more important, but also harder to do as people expand where they're going. So I'm just wondering if you think that contact tracing apps are useful, and I'm just wondering if you are developing one here in BC or waiting on the federal government.
Yeah, so obviously there's everybody and their dog has an app out right now. What we are trying to do, and what we have been doing, and I've been working with my colleagues across the country, is to find ones that might help us with the issues that we have in our contact tracing. And we have been trialing some apps to assist in that, particularly to assist in when we identify a case and we identify contacts, being able to connect with them and use some of the information to help find out where they have been and who they've been in contact with. We've been looking into this a lot. You know, we need to find the right IT support for the work that we're doing that doesn't create more problems than it solves. And so we have not yet found one that we feel meets the needs that we have in British Columbia for supporting contact tracing. I know there has been a number of apps that have been promoted across the country, and we were talking about them this morning. We're not clear that there's any evidence, at least in our context, that having something on everybody's phone that gives them generic messages about where they may or who they might have been in contact with is what we need right now. So we have not yet determined that there is a product that can help us with the needs that we have. We are absolutely working on this, including with our Provincial Health Services Authority, our IMITS experts and technical experts that are amazing here in British Columbia, looking at how we can augment the IT systems that we're using already rather than something new and different. But we're keeping our mind open for sure.
Next question is from Vaughn Palmer, Vancouver Sun.
Good afternoon. Minister Dix, for weeks now you've been reporting on 60% capacity occupancy rate in the hospitals, less than 50% in the ICU, from what we were told that normally at this time of year you could be approaching 100%. I'm wondering, has that meant a significant reduction of workload in the hospitals and any savings in operating costs or salary? And do you have any quantification on all that yet?
Thank you, Vaughn. No, I don't think so. We've prepared our healthcare system in full for the great challenge that COVID-19 might have brought and has brought to BC. And so, as you know, we made the preparations we made, and we didn't say because we're not doing certain procedures right now that those people can go home. We are fully in place and ready to provide care. It's why it's so important that people who need to use emergency room services, and that number has gone from 6,500 to 2,995 on April 6th to 4,600 today, that they come in because we are there and we are able and we are ready to do it. What we wanted to do was make sure that our hospitals were safe, that we had space available, and we had people prepared and trained and reallocated in case there was a surge of cases. As you know, in hospitals across BC, the number of cases topped up at 149, but there hasn't been any savings to speak of. In fact, there have been significant additional costs to the healthcare system, which will be required not just to deal with what's happened over the last numbers of days and weeks and months, but as we prepare for the coming days and weeks and months when we're going to have to address a considerable backlog in surgery. So no, we have reported that hospitals are less full than they are before, but we have stood ready, as people would expect us to ensure that our healthcare system was fully prepared to avoid a situation which we've seen in too many other jurisdictions around the world. This isn't a criticism, by the way, of those jurisdictions, but what happened in those jurisdictions where healthcare workers and doctors and nurses and others have shown enormous courage, that our healthcare workers weren't facing the same conditions, which means that we had to have our capacity 100% in place and have kept it in place, even as some cases haven't proceeded. So there's no savings to speak of. There have been, of course, significant costs as we've had to respond to COVID-19, and now that we have to, as a system, we have to address all of those cases and think of them for a moment. The surgery is not done. We will be providing estimates about what they are, but I think if you take a 2-month period, you could talk about 30,000 deferred surgeries, but also the referrals for surgeries and the lack of screening in some areas. So we're fully up and running, but there'll be more costs in the months to come, as people would expect as we deal with a pandemic.
Next, we have Georgie Smith, CBC.
Good afternoon, Dr. Henry or Minister Dix. When do you expect restrictions on non-essential provincial travel to be relaxed? For instance, could residents head to their cabins or second homes and take provisions for a few days and physical distance inside or on their property? Would this be considered safe? And une réponse en français aussi, s'il vous plaît.
Yeah, these are some of the things that we're, of course, thinking about and considering. We're looking at the basic principles that I've talked about and how they apply in all aspects of what we'll be doing. And I will say that the Premier's announcement tomorrow will have more details about some of these things. And that is one of the questions that, of course, we will address. We'll be looking at, what types of activities can we have in the summer? What types of sporting team sports sports can be played, for example. We'll be looking at the different retail sectors, the barber shops and hairstylists, and all of the different sectors. So more details about that will come in the coming days.
En français.
Okay.
Vous avez demandé une réponse en français, juste dire qu'il y aura des détails sur cette question et un tas d'autres demain. Mais cela étant, ça continue d'être important pour les gens d'aller dehors, surtout pendant un printemps remarquable en Colombie-Britannique, quand on parle du temps, de toute façon. Donc c'est important de continuer cela et je pense que ça c'est quelque chose d'essentiel. Je voudrais, parce que je ne l'ai pas fait en français avant, de dire qu'il y a 8 cas 8 nouveaux cas de COVID-19 en Colombie-Britannique. Il y a malheureusement 4 décès de nouveau depuis hier. Et nous envoyons bien entendu nos condoléances à tous ceux et toutes celles dont leur famille a été si douloureusement affectée sur ce point. Et j'espère aussi noter qu'il y a 78 personnes qui sont actuellement hospitalisées et 21 personnes qui reçoivent des soins dans un centre critique dans la province, un centre de soins intensifs. Donc ça, c'est la situation en français.
Marcella Bernardo, News 1130.
Hi, Dr. Henry. I know that you've talked about this before, but hoping to ask you again about concerns being raised by childcare providers who keep getting mixed messages about what is allowed and what isn't allowed. And many of them are concerned considering that trying to get a child to wear a mask would be nearly impossible. So they're worried about what kind of safeguards they can possibly put in place to protect themselves and the children they're caring for.
Yeah, this is something that we, of course, have been paying a lot of attention to, and more evidence has continued to come up around the world that children are not very affected by this virus, and also that they're not infectious very much to adults. So we need to put in place the measures that do protect our children and protect those who are caring for them in the childcare centres. We will and have been working on some more guidance, and it will mean smaller numbers. It will mean making sure that we talk about physical touching for young kids, because we know that physical distancing concept is not relevant really for young children. And how can we best protect our early childhood educators and our childcare providers? So we will be having more details about that. And do not expect young children in particular to be wearing masks. We know that is very challenging, and it's not something that you can do particularly for young children. So there is things that we can do that can help, and we know that there's good examples out there, and I've sent some pictures of one child care provider and how they manage things with their children. So there's lots of innovative ways we can do things safely for both the child care providers and for the children in their care, and we'll be having more details about that as well.
Next question is from Maria Rantanen, Richmond News.
Oh, hi. So there's been discussion about bringing back elective surgeries and other regular treatment. But now with the COVID-19 outbreak declared at Richmond Hospital, I wonder how much this is going to impede any plans to return to these elective surgeries and other treatments.
Yeah, so we will be having more details about that as well on Thursday this week or later this week. However, any facility that has an outbreak will be treated differently, as we know. We need to be very cautious about that, but the plans and the increasing access to both surgeries, but also to those diagnostic imaging and other things that have been scaled back will take into account some of those facilities that will not be able to do that. So yes, we know there's been challenges at Lions Gate Hospital and recently at Richmond, so it will depend as well. It was a single case at Richmond so far that I'm aware of, so a little bit will depend on the investigation over the coming days and how we can manage that to effectively upscale.
Ashley Wadwani, Black Press.
Hi, Dr. Bonnie Henry. 8 cases today will be welcomed news to many, especially the day before we hear what restrictions will be loosened or altered in coming months. Could you maybe speak to what an ideal summer might look like when it comes to the number of daily cases and hospitalizations, especially given that you have said in the past that we will likely see this respiratory illness resurge again in the fall?
Yeah, so my ideal, of course, would be no cases at all anywhere and no outbreaks, but, we're not there. And we've been watching people who have been ahead in their pandemic around the world, and we understand that with a virus like this that can spread quite stealthily, it's very challenging unless you're a very small island with very little external movement in and out to actually get down to zero. So our control measures will be to ensure that we can increase our social connectedness that we need so much in our lives, increase our economic drivers and the things that we're doing in our community within the boundaries that we talked about with the modeling yesterday. So we cannot right now afford to go back to where we were in December, our pre-COVID-19 ways of interacting, where we had large groups of us who came together in small spaces and spent time together. Right now, that is very dangerous, and it's going to remain that way through this summer and through next fall. But I do think we will learn. We are learning every day about this virus, about who it's affecting, about how it's being transmitted, about what are the most effective things to prevent it, about new medications to treat it, and we are getting closer every day to having a vaccine. So those are the things that we'll be watching. I think this summer, our ideal summer is to have low levels of cases that we are able to detect, and we're able to find people quickly, prevent clusters from becoming large outbreaks, making sure we have those safe things in our restaurants, in our businesses, in our essential businesses like our grocery stores and our poultry producers, so that we're protected. We're all protected, whether we're workers, whether we're consumers, whether we're staff in those businesses. So that's what we need to do. I also think that if we look around the world, we're not going to have a whole lot of global travel or international travel in the coming weeks and months. So this summer is one where I think we need to start thinking about looking close to home. What are the things we can do with our close family, with our close contacts in our neighborhood, in our area, and appreciate the beauty that we have and what we have here. And we need to focus on that. We need to focus on continuing to connect virtually with our family who are afar. And that's so important for us as well. So this summer is going to be like we're all trying to figure it out together. We're looking at what's happening with our neighbors, but it is one where we're going to be closer to home, where we're going to have to find our joy and our fun within our own neighborhoods.
Natalie Pearson, Bloomberg.
Hi, sorry, I'm just returning to something that came up yesterday in the latest modeling. There was a comparison of the death rates between BC and other places around the world, and it looked like BC's was really one of the lowest, far less than places in Europe and in the U.S., and the only other jurisdictions where you had a lower death rate was, I think, New Zealand, Australia, and South Korea. The former two are islands, and South Korea used some incredibly invasive methods to contact trace. So I just wanted to ask, how has BC managed to contain that death rate so well?
Yeah, so it is challenging. It goes back really to our timing, our planning, making sure that we did have that capacity to care for people who had this disease, and learning, the fact that we have a critical care group that came together very early on across the province to support each other in looking at what was happening internationally so that we could provide the best possible care to people who were in hospital and in critical care. That helped. But I think we cannot take away from the fact that, early on we had a very large outbreak in the Lynn Valley Care Centre, and most of the deaths, the largest proportion of people who have died in British Columbia are elders and seniors from long-term care. And that is the tragedy of our pandemic. So, we have lost some of those important elders from our communities and our lives and our care homes. So, I think we've done a really great job of caring for people who needed it in our hospitals, and part of that was the preparedness that we did. So it's hard to know. I'm just very grateful that we've been able to do that and continue to express our condolences and thoughts for those elders and seniors who we lost.
Next question is from Richard Zisman, Global News.
Dr. Henry, the Brewery Steamworks is claiming they can clean masks for hospital use. Is this something approved by the province, and are you looking at this as a potential solution moving forward for reusing PPE?
Yeah, so particularly respirators can be steam sterilized. They can be sterilized using chemicals and radiation. So there's a variety of different methods that we've been looking at both here in BC and across the country for doing that. I can't speak to that specific company and their way of doing it, but I know we have a whole group that has been in contact with a variety of different businesses around the province to look at how we can support this. We have some machines that are able to do it in some of our healthcare facilities in small numbers at a time. But yes, this is part of our contingency planning that we've done here, as well as our counterparts across the country.
We haven't used any.
Yeah, oh yeah. We've been using the technology, stockpiling it. We've not had to use those re-sterilized equipment yet, and that speaks to our need to make sure that we are continuing to get the PPE as was discussed earlier.
Okay, we have time for a couple more questions. Next up is Lisa Cordesco, CHLY.
Thank you very much. I'm wondering, to what degree will the excess deaths that were reported on yesterday inform your decision about resuming surgeries?
Yeah, so I think the surgeries, we have a pretty good idea about which surgeries were postponed, and there's a plan that will give more details about that and about which ones need to go forward. We won't have the details of the information around the cause of deaths in time to inform that strategy, but we certainly will be looking at that to see if that, if people who had surgeries postponed was one of the causes, absolutely, because that helps inform us for our response for the next wave, if we have another one, or for the next pandemic. Understanding those impacts is incredibly important. But in the short term, that is something that we monitor, but it's not a data source that is able to inform in detail the go-forward strategy with resuming the surgeries.
Okay, before we go to our last question, I'd like to remind all reporters on the phone that if you didn't get to ask a question today, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Dominique Lévesque, CBC Radio Canada.
Bonjour en français pour le ministre Dix. Pourriez-vous nous dire dans quel secteur d'activité le premier ministre Horgan va se prononcer? Donc, sur quel genre d'activité, quel genre d'industrie on va avoir des détails demain?
Premièrement, en comparaison avec d'autres provinces, que ce soit l'Ontario ou le Québec, on a fermé moins d'industries, moins de secteurs en Colombie-Britannique. On a établi dans plusieurs secteurs, par exemple, des règlements pour que les gens puissent continuer à travailler, mais de rester en bonne santé. Et c'est ce qu'on a fait. Donc, ça c'est la différence entre nous et d'autres provinces du pays et des États-Unis. Cela étant, il y aura des changements qui vont avoir un effet sur tous les secteurs de la société, parce que tout le monde doit se préparer et se protéger dans ces circonstances. Donc, on va faire des bonnes pratiques pour tout le monde, quelle que soit l'industrie, pour assurer qu'ils peuvent bien entendu, d'ouvrir, mais aussi ouvrir d'une façon qui va reconnaître le nouveau normal dont va exister pour quelque temps encore. Il n'y a pas de vaccin pour COVID-19. On ne peut pas se guérir. Il n'y a pas une façon de répondre très facilement à cette maladie. Ça va être avec nous pour beaucoup de temps, pour l'avenir, pas pour toujours, mais pour au moins un an, j'imagine. Donc, il faut avoir un nouveau normal qui va laisser des gens agir dans l'économie, par exemple, et dans la société, par exemple, mais aussi qui va assurer qu'on va réduire autant que possible la transmission de COVID-19. Thank you very much. Merci beaucoup.